Hey there, and welcome to U-Talk. I'm your host, Ryan Funk. U-Talk is a program dedicated to diversity, highlighting native-born and new Canadians' cultures and experiences. And sometimes we talk with individuals whose experiences and jobs help those coming to Canada. Moving to Canada can be an exciting experience, and there's numerous elements that one needs to learn when settling in their new home. One thing people may not realize is important when moving is water safety. Canada has many sources of open water, with some provinces experiencing severe flooding during spring. Dr. Christopher Love is the Water Smart and Safety Management Coordinator for Lifesaving Society Manitoba. Their mandate is to educate individuals on safe water practices and reduce the number of fatal drownings.
And what that means is I'm in charge of the Society's public education programming and our safety management services in the province of Manitoba. So I oversee things such as our Northern Water Smart program and our Winter Smart program. So those are outreach programs that we are able to do through government support from the province and the federal government, as well as some private fundraising, where we send staff out to northern remote locations that are otherwise unable to access water safety, ice safety, and similar services. And they provide basic swim instruction in the summer, boat operator safety training, basic first aid training. And then in the winter, it's ice safety training, and hopefully get into the schools for that to hit all the kids in a more captive audience during that time when we can't do that in the summer because they're on summer vacation. And then our safety management programming is a wide gamut of programs that basically look at what is the risk around aquatic environments and how can we assist with getting those to be safer. So that includes things like establishing pool safety standards, backyard pool safety standards, waterfront safety standards, position statements, training for aquatic supervisors and aquatic managers so they understand some of the risk factors in aquatic facilities and aquatic environments, if that's not something they are used to, because in Manitoba, at least, a lot of rec personnel are much more used to dealing with their local ice rink or the soccer field, because that may be what they've had more experience with in their own life experiences in sport and recreation coming up before they suddenly become responsible for a municipal rec department that also happens to include that outdoor swimming pool that is open for the summer months.
How dangerous can water be? You know, we use it for showers, drinking, there's pools. You mentioned something about a northern, visiting northern communities and, newcomers coming in, they might, not see as much water as here in Manitoba. So I guess why is it important to kind of learn those water safety tricks and, learn how to swim?
From our point of view, it's really important to everybody, no matter your background, but especially many of those groups that you mentioned, our northern remote populations, our newcomer populations for sure. We know they're at higher risk for injury or death, so non-fatal or fatal drowning, if they don't have safety education. So that is certainly a concern to us as a registered charity and as a humanitarian organization. Our mission is to save lives. And so that's really what we want to do. And it's something that a lot of people don't think about, but it is super important because it's amazing how quickly something can occur if you're not paying attention. Drowning is unlike the movies. It's quick, it is silent, it is something that is easily missed. And so if you're not used to this, if you haven't been educated in what to look for, then you're not potentially going to see it, and a tragedy can occur in terms of there being a fatality or a serious injury of someone in, on, or around the water.
Mm-hmm. So what sort of statistics are we looking at the dangers of water here in Manitoba?
Yeah, so in Manitoba, annually we see approximately 21, 22 deaths. The long-term average is 21. Numbers will fluctuate from year to year. In recent years, we've had as low as 12 fatalities in a given year, and we've gone as high as 40 fatalities due to drowning in a given year. And so from our point of view, even one death is one too many. But for every one of those deaths, the fact of the matter is there's going to be family, friends that are all going to be affected by that. And it's something we are continuing to work on, but we know that for every death, there is approximately 5 long-term injuries that also result from drowning, based upon studies that have been done in other jurisdictions. We unfortunately don't have definitive data here in Manitoba, but as far as we can tell, we do track with that general line of for every death, there's 5 long-term injuries. And then beyond those long-term injuries, which could be lung damage, brain damage, depending on the exact case. Then beyond that, you also have all the close scrapes where somebody may have been drowning but been saved. They might only have a short-term injury or no injury, but it still could have been very, very dangerous.
Mm-hmm. Do we have any information on how drowning statistics were affected by the COVID closures?
We do not at this point in time. We look at definitive data in terms of the number of deaths, and we get that from the Office of the Chief Medical Examiner here in the province of Manitoba. And they take approximately a year to 18 months after the close of a given calendar year before we can get that data. So the 2020 data that would encapsulate the COVID-19 pandemic so far, that will not be available until sometime either later in 2022 or possibly even early 2023. And so unfortunately, we don't have anything. Anecdotally, based upon media reports, there appears to be an uptick in the number of injuries and fatalities, but we won't know that for sure until we can actually see the definitive data.
Mm-hmm. Yeah, so it's more important than ever to, get people educated about safety.
Indeed.
Now we're starting to see the ice break and melt. People might be a little anxious to get out on their boats. Newcomers might want to go fishing or go on the boats for the first time. What sort of information do they need to know when, heading out onto the water, especially when it's so cold right now?
Right now, our general recommendation is that you should not be going out on the water. It is, as you've just mentioned, extremely cold water right now. There are still areas of the province that have ice, and I have heard anecdotal stories of people still going out for ice fishing. We don't have any enforcement authority, so I can't stop anyone from doing so. But what we are saying is we advise you not to go on. If you decide to go on, then you need to be prepared to go through whatever ice is remaining and into cold water. And right now, this time of year, the big concern is what is called cold water shock. And so if you go into cold water, whether it's open water or going through whatever ice cover remains, first thing that's going to happen is you are going to experience that cold shock reaction, which means for about the first minute after you hit the water, you're going to gasp and or you're going to hyperventilate, breathing very, very quickly, and your body is going to go into overdrive. And so you need to have prepared ahead, because if you are not above the surface of the water when that cold shock reaction happens, then potentially you're going to be inhaling water into your system, into your lungs. You're not going to be able to breathe. And you can unfortunately die in the first 15, 20 seconds due to that drowning effect because you're not breathing air. If you are wearing something that makes you float, like a life jacket or a floater coat, a flotation suit, then that gives you the chance to catch your breath and figure out what is your next course of action. Can I get back onto my boat? Can I get back onto the ice? Can I get back to shore and remove myself from the danger? Because the next stage that I'm now going to contend with after the cold shock is what we call cold incapacitation. And that is you've got about 10 minutes, give or take, to work your muscles before they are going to become so cold, they're not going to function properly and be able to allow you to self-rescue. Or assist someone else in rescuing you if someone is still on the boat and is throwing you a rope or something else to assist you. And so we have to be aware of that. And then the final step is if you can't get out of the water for whatever reason, then you've got about 1 hour before you go unconscious due to the effects of the cold. You basically go into hypothermia and you go unconscious at that point. And then that's potentially really dangerous because you get colder and colder at that point. And can die from hypothermia if you're out that long. And so to prevent everything that I've just said, you have to do that preparation in advance. So wearing something that makes you float, letting someone know where you're going, and basically when you plan to be coming back, not going out alone. So you're going out, you've told someone where you're going when you plan to be back, but you're also bringing a friend or friends so that if one of you gets into trouble, somebody else can assist. And then depending on your exact activity, you're going to have to undertake other preparation as well. So for boating, making sure all of your boating safety equipment is on board, making sure you've prepped the craft. And I'll be totally honest, right now, with ice melt and everything, there's a whole lot of debris in the water. Not a really good idea right now to take your boat in the water because you're more likely to hit something, whether it's ice or other debris from both the freeze up in the fall and things getting swept in various areas due to the spring melt.
Yeah, I know for myself, taking part in polar plunges, like you really have to get a strong mental sense before you go in the water. I can't even imagine just falling in, especially wearing all your clothing.
Yes, and that is a real concern. Not being prepared, that cold shock, if you're not prepared for it, it is more likely that you're going to suddenly gulp something back. And you do bring up, if you're wearing clothes, if you're wearing layered clothing to prepare for the weather, that's a good thing. It will help keep you floating for a few minutes until your clothing gets totally waterlogged. But we do recommend, on top of that, that you have that dedicated flotation device. And I know it sounds silly to many, many people, but it can be a real lifesaver, is wearing your life jacket, even in the winter or the early spring or the late fall, even if you're just walking on shore near water in case you do fall in. And especially if you're out on the ice or in the boat, you need to be wearing that because the unexpected can happen. Rogue waves, if you're out on the lake, can hit the boat, tip it just enough that you lose your balance, you fall overboard. You had no intention of going in, no intention of going swimming, but you can end up in the water. And so you need that support.
It's still several months away, but what sort of mindset and things should people know, once swimming season opens up?
A lot of swimming season advice tracks very similarly to what I've already mentioned in terms of don't go out alone. Make sure you tell someone where you're going when you plan to be back, but have that buddy with you. We also recommend, once it comes around to swimming season, go to somewhere that is a designated and supervised swimming space, because that is going to be safer for you. So don't just go to a random beach. Go to the beach where there is a lifeguard patrol or a beach patrol that is going to provide an extra layer of safety supervision. Go to the pool that has lifeguards. That's really, really helpful. That's an added layer of protection. Making sure you've got that buddy with you. That's an added layer of protection, especially when it comes to the summer months, but year round, really important, but especially in the summer. For those of you who are parents or caregivers for smaller children, adult supervision of those children is super important. What we call being within arm's reach. So essentially your 6 and under age group, you need to be able to grab them and they need to be able to grab you when they are in or near the water, just in case something bad happens. They could get scared and want support. You could notice that they're about to fall face down and you want to be able to grab them. And then for the older child groups, so like your 7 to 12-year-olds, you don't necessarily have to be within arm's reach, but there does need to be active adult supervision. What we often call a parent lifeguard. So even if you only have a backyard pool, for that age group, if they're in the water, there needs to be an adult watching, and that's their sole job, is watching the kids. They're not cooking, they're not reading, they're not on their phone, they're not engaged in heavy conversation with another adult. because they need to be paying close attention, because drowning can occur, as I said earlier. It's fast, it's quiet, it's easy to miss. For a child, they can drown in as little as 10 seconds, and it only has to be enough water to cover their mouth and their nose. So even something like a small inflatable or a Mr. Turtle pool or something like that, that's enough water to cover the mouth and nose that a child can get into trouble in.
So if you see someone is in trouble, what should you do?
If you are in one of those locations that is supervised, certainly immediately call the attention of the lifeguard, the beach patrol to it, because they have professional training to respond. If you just happen to be out alone, then you need to be keeping in mind your safety. The last thing we recommend is actually going out to the patient. What you want to try to do is, before that, use what we call a ladder approach. You want to be as safe as possible and stay as low on the ladder as possible, which means the first thing is, maybe you can just actually help them by talking to them, yelling out to them, trying to get them to calm down, trying to get them to flip onto their back if they're able to, and relax and float. And that may be enough to get them out of immediate trouble, and then allow you to figure out, okay, now I'm going to throw you something that floats. Maybe I can find a rescue aid that's on the beach, and maybe it's a pool noodle, maybe it's a life jacket that somebody left lying around that I can toss out, or maybe it's something like a garden hose or a rope, something with some length to it that I can toss out that they can grab onto, and I can stay safe on the beach or on the boat and pull them to safety. Because we do know from a long history of research and observation that somebody who is actively drowning, who is in trouble, they become extremely scared, extremely panicked. And if you try to go in after them and you don't have rescue training, there is a very real chance that they can grab onto you and cause you to then sink below the surface and become another drowning statistic. And it's not because they're trying to be mean. It's not because they want to hurt you. It's because they are just so scared. They're not thinking rationally. And the big thing that's been recounted by survivors in many cases is they saw the person that was coming to rescue them. Well, they're above the water. They float. Therefore, if I climb on top of them, I will be able to float and I'll save myself. But factors being what they are, we're not designed to float on top of each other. We're not good flotation aids when we suddenly add another person's weight to us. And so that's why what can be double tragedies can occur, where a rescuer actually becomes a fatality if they didn't have appropriate rescue training. And so if you want to learn how to do that, we think that's a great life skill. And that is something that we think many, many more people should learn. And with pools reopening, that's something people can start doing. But the Bronze Star and Bronze Medallion Awards, that are programs that we offer through swimming pools and beaches across the province and across the country, are great awards for those people who do want to learn how to help someone else in distress.
So you mentioned before some of the programming the Lifesaving Society Manitoba offers, but what are some other ones? And, as restrictions begin to ease, what are kind of the plans moving forward in terms of, education about water safety?
We have a suite of programs, like you've mentioned. And so those are offered through what we call our network of affiliates in the province of Manitoba. And that is the swimming pools, the waterfronts, where you take your swimming lessons. And if you are going to your local pool, your local waterfront, if you want the life-saving training that I've mentioned, you want to ask for Lifesaving Society programs. And so those would include what we call our Swim Patrol program, also known as Rookie, Ranger, and Star Patrol. And then our Bronze Medal Awards, Bronze Star, Bronze Medallion, Bronze Cross. Those are ones that allow anyone to get a basic level of life-saving skill and experience, along with building some personal fitness. For those who want to go further, if they want to become a lifeguard, the National Lifeguard Certification for both pools and waterfront options is available once you have the appropriate prerequisite skills. First aid training is offered through many of our affiliates. So what is called emergency or basic first aid and intermediate or standard first aid, those courses are offered. And we also have a lot of public education programming. So I've mentioned our Northern Water Smart program. That will run during the summer for the northern remote communities. But your local pool will also potentially offer some of our Water Smart programming, is what we call it. And that is public education. So you might see posters. They might have a special event day where they're doing water safety. Come July, we will be running what is called National Drowning Prevention Week. And that is an annual event where the Lifesaving Society promotes ways to be safe in, on, and around the water as part of our water safety education. And this year, National Drowning Prevention Week will run from July 18th to 24th. And so expect to see and hear more notices from the Society as events ramp up for that. And you'll be able to get notification for that through our website and through our social media feeds. We're on Facebook, Instagram, and Twitter, along with being on the web at www.lifesaving.mb.ca. And people can check in anytime to see the latest news, the latest courses on offer. For those who may be in the job market and have the skills already, we do have a job board for aquatic employers where you can see if there is somewhere you want to work. And certainly I know a lot of people will be advertising for jobs as things are able to reopen this year as COVID eases with the vaccine rollout.
Mm-hmm. Is there anything else you'd like to add at this time?
I think the biggest thing is we want everybody to have fun. We want people to use the water. We want you to experience the water. We want you to look at fun, health, fitness, family together time. We know that aquatic activities, they're great for physical health. They're great for mental health. They're great for community building. We just want to make sure that as that happens, everybody is having a safe time while they are doing so. And that basically at the end of the day, everybody goes home and is able to do it again the next day again.
And I think an important part to add on to that is to not consume drugs or alcohols before you go out on the water.
Indeed it is. Indeed it is. That is an important part of all of our education on our website, on our social media feeds. It's a big risk factor along with being alone or without adult supervision for the young people, children, toddlers, etc. And then depending on the activity, there are other risk factors that come up as well. So basically being safe, really important. And yeah, you save the party until after you're off the beach or off the boat for the day.
If you have any stories you'd like us to share or communities we should highlight, leave a comment on our social media or reach out to us on our website. I'm Ryan Fung. This was You Talk, and have yourself a good one.